fatigue can be an issue with various chemotherapy regimens. Can you tell us more about how to combat that problem?
Sure. What we know about fatigue is we can control a lot of side effects, but fatigue is one that we really can't control ourselves. But there are lots of things that patients can do to help themselves with that. They've looked at fatigue with chemotherapy, and it's a different kind of fatigue. It's something the average person wouldn't probably understand necessarily. So we tell patients to really listen to their bodies, and if you need to rest, to make sure you rest, and that napping during the day is okay. A lot of people resist that urge to nap and rest. So we say that that's fine to do that sort of thing and listen to your body. We also know that exercise helps, so we really encourage patients to try to do some modest exercise, whether it's walking or some cardio or something that they can tolerate. They don't need to push too hard or anything that's going to really exhaust them. But exercise several times a week definitely helps fight the fatigue. We know that, and some of the other side effects. We also really encourage people to get a lot of sleep, whether that's 6 hours for you or 8 hours, and try to rest when you can. And as far as working your average working schedule or your regular working schedule, we ask folks to adjust that as they need to. So if they need to slow down on pace, depending on what they do for a living, that's absolutely normal, that they should do that for sure.
I know that, for example, with naps during the day, it's always probably a good idea to set an alarm because it's easy for a sleep-wake cycle to become altered.
It is. A lot of folks can sometimes nap for hours during the day, and then when they try to go to bed at night, they're unable, and then they're awake all night, and the cycle can be really terrible, and then they're exhausted and sleep-deprived to some degree. So definitely shorter naps we encourage, and like you said, maybe setting the alarm or having somebody wake you up after 30 minutes of napping, and maybe not more than once a day.
I often see a problem where patients equate being busy with being exercising, and most people during their work schedule have these incredibly intense days, but they're not actually exercising, so that's not necessarily helping you combat fatigue.
Right, that's probably just adding to their exhaustion. We encourage people to take the steps at work if they can do that, to try to get out walking in the evenings or on the weekends, and that sitting behind the desk, if you're doing that sort of job, being busy is not exercising. So we encourage them to get out and walk. Seems to be a really easy exercise for folks.
And I know it varies with regard to the chemotherapy regimen, but if I'm getting treated today, about when would I expect fatigue to set in?
Takes probably 5 to 7 days, and people usually feel the impact of that about a week after their treatment. And we tell folks to look out for that. And sometimes it's mild fatigue. It depends on the patient, or the age, and were they exercising before they started chemotherapy. All those things make a difference. So some people really have minimal fatigue. A lot of people have exhaustion, and a lot of it also depends on the chemotherapies that they're receiving. But that's probably a good time frame for everyone.
I also tell people it depends a lot on why you're taking chemotherapy. We mentioned at the beginning of the video, some people are taking chemotherapy to alleviate symptoms. And if those symptoms are very significant and the chemotherapy is effective, you may actually feel better while you're taking chemotherapy. Whereas if you're taking chemotherapy for a preventative purpose and you feel completely well, then you have to expect fatigue as a necessary side effect of the treatment, and then try to ameliorate it with some of the strategies you just enumerated.
Right.